Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, welcome. Super excited to have you here because we're bringing some just amazing conversations with leaders that are really changing the trajectory of healthcare. And we're really passionate around innovation, adoption, access, and leadership. And if you haven't tuned in before, thank you for tuning in, and make sure you hit the subscribe button now for any new episodes that are going to come to you directly to your inbox. But let me just tell you a little bit about what we're trying to do here. And our focus is really about bringing stories of innovation to life. So real people that are really truly innovating and getting stuff done and giving them the space and the platform to be able to share their stories with our community and ultimately with the world. And we have an amazing action-packed year with just some incredible interviews that are lined up. So looking forward to that. And our field, it's always evolving. There's things that are happening, and it's just super critical to be able to talk with leaders that are actually changing and envisioning the future differently, and that are embracing innovation and addressing a lot of these pressing challenges. And our next guest on the show is one of these leaders. And Laura Robbins, she's the Chief Operating Officer for Advocatia Solutions. And she comes to us with a really robust background in healthcare. And really what sets her apart, because we've had a few different conversations, is her commitment and her focus on addressing some of the most pressing issues related to healthcare accessibility and equity. And as the co-founder of Advocatia Solutions, she and her team have been at the forefront of creating innovative tools and services designed to assist hospitals and various other entities, aiding the uninsured and underinsured to easily find, navigate, and secure available benefits. And under her leadership, Advocatia has grown into just a tremendous resource for a number of their customers and countless individuals in need. And just with respect to that, we want to really be able to learn more about the impact that Laura and her team are having. So I'm eager to, selfishly to uncover a lot of these insights and the inspirations that really drive Laura and the team to transform healthcare access and affordability. So Laura, welcome to the show. It's great to see you. How are you?
Good. Thanks for having me on today.
Yeah. So let's dig in. Let's talk about why this problem. What has gotten you to sort of figure out that this is I'll call it a wholly discontent problem? Tell us a little bit about sort of the origin story and your background. Love to learn more about that.
Yeah, so me and my co-founder, Ryan Brebner, we started Advocatia in 2016. And the catalyst to starting Advocatia was a woman named Davila. My co-founder, Ryan, has a background specifically in revenue cycle and helping with Medicaid eligibility. At that time, it was heavily on the servicing side. So boots on the ground that were at the hospital, helping
Yeah.
patients every day enroll into Medicaid and other programs. And at that time, Ryan had helped a woman named Avila family enroll in Medicaid. And through that process, he learned that Avila had gone to the emergency room for things like the flu and ear infections. But when she had stomach pain, she didn't know where to go. She didn't have that
Mm.
access. She was uninsured. She'd gone during, like many uninsured patients, she'd gone during second and third shift when there might not have been somebody there. She wasn't admitted, so wasn't seen in some of the other channels of services to help with that program. And as a result, unfortunately, she lost her life within a few short days of being admitted into the hospital with stage 4 stomach cancer. And after
Wow.
Ryan had assisted her family, she was eligible for Medicaid that whole time. She was enrolled, and so thankfully it did cover that bills for those visits, but they lost their mom. They lost a family member,
Mm.
something that could have been preventable. And so at that time, Ryan and I really just started talking about there has to be a better way to inject technology in this process for both allowing the individual in the healthcare ecosystem to know that they're eligible quickly to take those next steps for enrollment, but also to empower those teams that every day are helping patients. How can they help more patients, more members, more people in the community enroll? I've talked to a lot of folks that are doing this every day. They're very passionate. They want tools to be more
Yeah.
effective, to have a bigger impact. And
Well,
so,
that's an amazing story. Just personally, I know a number of people that are on Medicaid. I grew up not with a ton of means, and a number of our family members were and still are on Medicaid today. And what's that enrollment process like? I mean, how cumbersome is it? And for those that are especially non-native speaking, what are some of those barriers? What do those look like today?
There's a tremendous amount of barriers. You're asking for somebody's pay stubs and documents, even sometimes something as simple as a social security number. I don't have that readily available for my son. And so you're asking them for that information. You have to track down documents, numbers. In some situations, they need other documents like assets and pay stubs if they're doing a spend down program, for example. So it's asking a lot and it's a lengthy application. They're usually, 12 to 16 pages when you're asking for that information. And that's just for Medicaid, not including other programs that are available for the under-resourced population. And you're also asking them the same questions. You're asking somebody, one patient told me, you're asking me to prove I'm poor over and over to get access to the programs that I'm eligible for. And I think that that does summarize it. You're asking someone that does not have a lot of time and every minute of work is valuable to miss that to then access healthcare and access food assistance. So, just the cumbersome paperwork and navigating that process alone and those questions, it's like doing your taxes all alone too. I have someone that I use to help me with my taxes. And so it's just like that process and asking someone to do that when they're unfortunately sometimes somebody obviously they're under resourced, but they likely have a health event that's occurring. And so that's adding additional stress and they really need those resources and those eliminating those barriers is something that we've been thinking about since day one and how we make that easier for the end user.
What do you think are some of the common myths that someone who maybe feels like they could potentially be, fit in that Medicaid bucket? What are some of the barriers for them actually even going through the process? Are there stigmas attached to it? What have you learned throughout this process in this time?
Yeah, we've learned language is really important. So I know you brought up in the last question, we're in 72 languages. So when we're texting patients, we're making sure that we're texting in their preferred language to communicate
Mm.
those programs. But not only that, it's how you're communicating. It's a charity care program, financial assistance. We found, for example, in rural areas, some people think that charity care and financial assistance is taking from their neighbor, and there's just one bucket, and that's not the situation. But from somebody that's a part of a community, they think that they don't want to take from their neighbor even though they're eligible. And so
Mm.
really having a trusted way to communicate and let somebody know that they qualify from those resources and it's not taking from a neighbor. It's let's help you get on the program that you are eligible for.
And so because predominantly, you're serving health systems today, do they have an awareness that this is an issue in terms of enrollment? How do they view this, and what are some of the things that they tried prior to what Advocatia is doing that you guys
Yes.
stumbled upon?
Yeah, absolutely. Many providers across the country are either doing this work internally or they have a vendor that's helping, like my co-founder's previous company that's helping with
Mm.
that Medicaid eligibility. And a lot of times they're seeing that, we'll go into healthcare systems that are using Excels to manage this process when they have teams.
Cells?
Excels or pen and paper. Sometimes they're going to a room, with a post-it note and writing down the information and then going down to their computer. And so, as one VP of revenue cycle said, you're taking us out of the Stone Age by having this tool available for my team and bringing us into the 21st century. Really saving time for the team and that allows them to have a bigger impact and see more patients. Sometimes they have to prioritize the higher dollar and if we save time. So we save financial counselor teams 33% more time. And that means they can see 33% more patients. That means that they can call that patient that might not reach that dollar threshold, like an Avila, or we can have automated text messaging go out to really help enroll and educate people on their eligibility.
Hmm. When you mentioned something around taxes, and I keep thinking like TurboTax. It's something that takes lots and lots and lots of information and dumbs it down into sort of a series of questions. How relevant is that in this particular case?
It is similar in that way. If if you're an individual and a consumer yourself, if you look
Yeah.
at a 16-page application, that's overwhelming. And so if we simplify it down to easy to understand questions, so someone can engage anytime, anywhere. We have self-service tools, and in real time, that's available for financial counselors or anybody on the back end that's helping the individual. So we see a lot of those being answered at 1 o'clock in the morning. When is it convenient to find my son's social security number? When is it convenient
Hmm.
to find those documents that are needed to make sure that I gain access to Medicaid and other programs?
Interesting. So when you think about the deploying of this, you mentioned that there's some the human connection, the human relationship. Talk about the relationship between the people, but also the balance of the technology. How did you figure out what that balance was? Because there's just a lot of moving parts here. It's very complex.
I think there was an understanding, I think, when we first started that under-resourced people didn't have cell phones or they wouldn't engage in technology. And I'm very happy to see that mindset change and shift.
Yeah.
But, we started in 2016. It wasn't that long ago where, I'd have that feedback from CFOs. I don't think this population has text messages. And we've been able to prove that wrong. That's a wrong assumption. Just like most people today, I prefer to text message. I went to a meeting recently where a director said, I'm not answering a phone call. Like, so if somebody's not inpatient, I think the most convenient way is to have multiple tools in your tool set. So if you are somebody that's assisting an individual, maybe they prefer a letter, maybe they prefer a text message, email, or that face to face. And I think if you have all those options available, you can capture a larger percentage of your patient population and then see that uplift in engagement and making sure those patients are in the right financial bucket.
Yeah.
Are they uninsured and qualify for ACA? Do they qualify for Medicaid or financial assistance? And I do think, at least the population and the individuals that we work with, that is the goal. Is how can we help these individuals? How can we reduce bad debt for the hospital, but also, have that access to care moving forward, which of course is so important to us, like Avila. If you can access those services and through Medicaid, that's at the end of the day the goal of everyone we work with.
What kind of feedback do you typically get from patients? Do you guys hear more of these patient stories? Are there any ones that really come to mind? I mean, you mentioned the tragedy of Avila and how you were able to get her enrolled, and tragically, she lost her life. But are there other ones where there are like major successes that are just like a shot in the arm? And if so, do you mind sharing a few?
Yeah, we get so many reviews that are, this is easy, this is great. Just we do have at the end of our self-service tool a star rating. So patients can rate out of 5 stars, and we're currently sitting at 4.75 out of 5 stars across all of our
Nice.
clients, which we're very proud of. I did review those recently, and one patient in California said, that I was crying every day. I was so afraid to go to the hospital. We didn't, because we were uninsured. I didn't know I qualified. And she wrote that her and her daughter lost housing. They were living on a friend's couch. They had no access, and she was scared to bring her daughter into the hospital. And because she was able to use our technology, she knew she was eligible. And we made it easy to help her get enrolled and then stabilize from there on. So this was a recent review. But
Wow.
that alone, I'm a mother as well, and to lose housing, to not have access to healthcare. Um, she said again that she was crying every day. I can empathize with that, and making sure that she receives that access for her and her daughter.
So there's a direct to consumer component, it sounds like, where people can directly find Advocatia. How do they typically find you? Is this word of mouth, or do people just search on Google and come up, and how does it work?
So we are always working with our clients. So there's different situations. Sometimes it's a text message from a provider that starts
Okay.
that engagement, or other times we're at a community level where, for example, Ascension, Illinois, we are a resource available for the community at large, as
Mm,
part of their community benefits to make sure that there is that access to healthcare. For the Chicagoland area and beyond where they serve, and other clients as well, just making sure, we have clients in Kansas that is also available at large, where we have a link for, that state or that region that we're serving. So it does depend on the client relationship that we have, but we're never charging a consumer as we're helping with that direct contact. It's really the self-service screening as well as the enrollment component that's powered by our clients and sponsored by our clients.
It sounds like then there's the relationship that you have with the clients is, excuse me, it's more of a partnership. And partnerships are often crucial in expanding services and impact. Outside of the client partnerships, are there any other collaborative efforts or partnerships that have been instrumental for Advocatia?
We believe strongly in partnerships. When somebody is connecting with a group, we want to make sure that it's not a point solution, that we're all coming together. I don't think this can be solved alone. Advocacia today is in 34 states. We're programmed for 50. And, how can we make sure that anybody that's uninsured, under-resourced, quickly knows that they're eligible? And whether that's they're going to a local clinic, whether they're going to a local provider, or they're working with their payer. So we believe strongly in that collaboration. I think that's the only way that we move the needle as a healthcare ecosystem.
So you mentioned you're in 32 states. Medicaid is sort of a state-driven, state-by-state thing. Talk about, varying complexities and policies. What is that like? I mean, do you have a team of analysts that are looking at stuff and organizing to the degree that you can share? What's that been like?
Absolutely. I mean, those rules change also annually. Those
Yeah, yeah.
applications change. And so we have a team that's making sure that our screening algorithms are always up to date. And so that not only if a patient or an individual is self-servicing, but also to empower that staff. You think about training. If you have, 60 or more financial counselors that are going bedside and making phone calls, how can you make it easily available for them to screen for multiple programs and not have to memorize a federal poverty level chart sheet or having to pull that up? So we do have a team that allows for that, as well as and the application part as well.
So when they're going in and counseling patients, are they doing this on an iPad? Are they doing this on a laptop? What's typically, how do they usually interface this with patients?
If you talked to me 2 years ago, I'd say usually a laptop, but we've seen that transition to tablets and
Yeah,
iPads.
yeah.
But both are available for capturing those signatures and completing those applications.
Okay. And in terms of new innovations that you and the team are working on, what can you share with us today that like you're really excited about?
What I'm always excited about is how to make it easier for the individual. Again, there's so much stress that goes along with being under-resourced, and how can we reduce those barriers? And so we have continued to move the needle on our engagement tools. So if there is somebody that's eligible, we'll ask unique questions and have a unique experience per client. And to me, that's really exciting. You know, Depending on rural and urban. And there's all these variances on priorities of providers as well, whether you want to include SNAP programs and
Yeah.
financial assistance, and making sure that at the end of the day, that's the best experience. That's what we've been really bullish on and excited to continue to improve and help with that patient experience and satisfaction, to really know that your local healthcare entity or even your plan that you're working with is a trusted entity that wants to help you and gain access to those programs you're eligible for. So that's something that is alongside just collaboration. I'd say we've
Yeah.
had great partners that have the same goals or similar goals that we've been able to then have APIs and work directly with to drive that impact further.
Yeah, it sounds like alignment is a big thing for you and the team. You mentioned around, and in a few of our other conversations, I kind of got the sense that you have a deep level of empathy. How when you're creating this culture of innovation and making things easier, making things better, and you're also trying to infuse empathy into your team, especially when you're dealing with these sensitive issues. How do you do that at scale? How do you do that across the health system? How do you do that across a whole entire network? Is it sort of a one by one, or is there something else that you and the team have been able to sort of unlock to make that happen at a much greater rate?
I think unlocking it is really just testing and exploring new options, whether that's scripting, and we've really been able to move that needle. So historically, we've seen 2 to 3% of individuals that were cooperating in processes when they were sent a letter in the mail, for example.
Okay. Okay.
And we've been able to increase that all the way up to 86%. And
You said 86 or 8.6? 86.
86. Yeah, our
From
average
2
is
to
40.
86.
Yeah, our average is 40%, but some clients that really have worked with us on scripting and other things like timing of when we're engaging with people. So we've really spent a lot of time and we have a lot of data to be able to explore that. And because of all that testing, we've been able to then now give those learnings to new clients, so that now they're starting on third base instead of first base with the
Yeah.
testing, so we can continue to help improve that impact.
That's interesting. So how do you see the role of, this, it sounds like you have a massive data set that you've amassed here and a lot of analytics, and the buzzword is around AI. But how are you leveraging that now to really transform what you're delivering?
That we have that in the background, just empowering those decisions and some other proprietary items that come into
Yeah.
play there with Gen AI. And I do think it's so impactful. Just if you think about what's in your tool set and how you can be innovative is, again, how can we reduce that financial counselor's time, and what can we do in the background to improve that, to have anything that can be automated, whether that's a text message, making a decision based on other items. Not to get too granular here, so but
Mm,
that is
mm.
definitely top of mind for our whole team, is to make sure that we're helping there and making our tool as powerful as possible.
What about, advocacy around policies? It seems as though that what has the role been in terms of you as an earlier stage company? I mean, 2016, you're not old. What is it? You're a company. You're a company. You have clients, you have customers that are thriving as a result of using your technology. What role can Advocatia play when it comes to advocacy, whether it be on a state, local level, even at a federal level?
So what we've done at Advocatia is really monitor those policies. So for example, in Illinois, we have the Fair Patient Billing Act that's come out and really empower hospitals to do that screening simply, because it is a compliance box that has to be checked. So if you're not familiar, there's many states, Minnesota, Oregon, that have implemented these similar policies, mostly
Hmm.
related to financial assistance. And we just want to make it as easy as possible to implement that. So we do have a way to have just that screener available and reporting if there's a lower lift, also instead of using our whole robust platform. But we really want to make sure that we can help providers be compliant and without increasing the cost, because when there's these new regulations that come out, even with the best intent, making sure that we're not sending a patient to bad debt before we screen them, that does take a lot of work for the hospital staff. And so we're really looking at any place that we can help optimize that workforce and streamline that through technology, so
Mm,
that it's not an additional burden and costly for the healthcare system, but really moving in the direction and downstream that's also helpful for the bottom line in the hospital. Because every executive that I've talked to at hospital, they don't want someone that's eligible for Medicaid going to bad debt either. That's not a good item for their community, but it is
yeah.
also not helping their bottom line. And so working together and to make sure that we're following those policies and checking all those boxes from a legislative perspective, and allowing them to screen, and in the case of Illinois, screen for multiple programs at once,
Mm,
and have that for both their team to access quickly, but also for us to be able to text and screen and have those results.
mm. And what are you As you're planning for the future, what do you see are some of the biggest risks? What do you think could derail something like this, and how do you plan for that?
Yeah, that's a good question. I think some things that could derail it is you know what, let me think about this for a second.
We didn't plan
Um,
these questions in advance, people.
no,
Your brave soul coming in.
there is some things that could derail it is if there are things that are implemented from legislation that would help to remove those barriers. And to me, that's the best case scenario. Our goal and the reason we built our platform is to make it easier for individuals to gain access to programs they're eligible for and easier for those teams that are helping. And so if there is, a universal program that you're auto enrolled in that would simplify the process, that would remove a lot of the barriers that we're solving for. We're making it easier to gather documents, easier to gather signatures. And so if we did move in that direction, that would be something that I think our whole team would be excited for.
Yeah, yeah.
Our goal again is to have that access and remove those barriers. And right now, that's certainly not the case. Like you said, every single state has their own programs and their own requirements, not only for who's eligible, but also how to enroll. And if it at a federal level, those barriers were removed, that would put us at risk. But I think
Hmm.
for the benefit of the community at large.
Pretty cool. And as I was kind of thinking through that question and some of the risks, how, how involved are you all with EMRs, with those systems, and do those pose as let's just call it what it is. I mean, the epics of the world are saying they're building stuff. Do they even encroach upon this space, or is this too nuanced where it's just out of their swim lane?
So we do integrate. So most of our clients are in Epic, but we have Cerner, Meditech, other EHRs that we work with that integrate. You know, We've seen some clients that have pieces of this available, largely around financial assistance, but
Hmm.
really it's not delivering the same level of engagement. And it's quite costly when you're going through those EHRs. So we do offer better patient satisfaction on where we are today from our learnings because this is our focus. Our focus is on Medicaid and under-resourced programs that we can help connect where the EHR is really designed for clinical. They're a great tool for everything clinical, and the financial aspect is really where we're focused, and we can integrate and work well to make sure those financial teams also have the same information. And but again, to me, the EHRs are designed around clinical workflow, and that's been their
Right.
focus, and that they're good at that, making sure that that's delivered in a digital, innovative way. And we're
Yeah.
really focused again on these unique programs that live outside the EHR and are really at a government level and always changing.
How do folks follow your work? How do they follow you, follow Advocatia and the stories? Give us a little bit of a snippet there as we kind of come towards the end of our time together.
Yes, LinkedIn is the best place to find us. So it's Advocatia, also my personal LinkedIn. You
Okay.
can follow along for Laura Robbins. And we also have a website, advocatia.io, where we post some of the stories and making sure that we share and announce any collaborations that are exciting and we can publicly announce.
Awesome. And for individuals or organizations that are eager to want to make a difference as it pertains to healthcare accessibility, what advice would you give them on where to start and how to make a meaningful impact?
For me, I think it's starting. How are you using innovative technology? When you get into the weeds, sometimes I find that leadership at providers are surprised on the workflows that the boots on the ground are doing. And so they see a lot of opportunity to help ensure that patient satisfaction and member satisfaction as well as engagement. And so I think getting started with a strategy, and you can always start small and build on that, but
Yeah.
it's that getting started, because you're gonna see those effects downstream and making sure that you have a strategy in place for that today to affect tomorrow.
That's awesome. I mean, so for those that have been tuning in, if you found this conversation helpful, personally, there were a lot of golden nuggets that I've extracted out, and I'm gonna continue to ponder on. But if you found it helpful, please share it, like it, comment on it, get it out with your communities and your networks, because like you said, just get started. Get started. Sometimes when people won't thinking about innovation, innovation is about moving. It's not about being potential. It's about being kinetic. So I'm looking forward to having you come on. Obviously, we always encourage our guests to come on again and share updates. So we'll make sure that we put your link in the description and how everyone can kind of follow you. But it's been awesome having you on today, Laura, and it's a pleasure. Looking forward to our next chat.
Thank you. Nice seeing you.